Research has shown the hormone dihydroepiandrosterone, or DHEA, is abnormally low in patients with macular degeneration. DHEA has been found to protect the eyes against oxidative damage. Because the macula requires hormones to function, an emerging theory hypothesizes that low blood sex hormone levels causes the retinal macula to accumulate cholesterol in an attempt to produce its own hormones. The accumulation of cholesterol in the macula might lead to the production of the pathologic drusen and the subsequent macular degeneration. An inverse association of female hormone with neovascular macular degeneration was observed with current and former use of hormone replacement therapy among Caucasian and Latino women. Restoring the optimal hormone balance with bioidentical hormones might be an effective treatment for both men and women. Clinical studies are underway to test this hypothesis and possible hormone treatment options. Melatonin is a hormone and it's a strong antioxidant that scavenges free radicals. Several studies have shown many areas of the eye have melatonin receptors. In a clinical study, 100 patients with dry and wet macular degeneration received 3 mg of melatonin at bedtime. The treatment prevented the further vision loss. After 6 months, visual acuity had not diminished, and the majority of patients had reduced pathologic macular changes upon examination. Soy contains the phytonutrient ginestin, and this has been documented to have anti-angiogenesis properties, so it's postulated to be the result of inhibiting VEGF. And this property of inhibiting the blood vessel growth is important in limiting abnormal ingrowth of the choroidal blood vessels. In mice, the ginestin inhibited retinal neovascularization and the expression of VEGF. Therefore, soy may be protective of the eyes. Oily fish, as well as flaxseed, are important sources of omega-3 fatty acids, essential for the protection against macular degeneration and other diseases. A meta-analysis found patients with a high dietary intake of omega-3 fatty acids had a 38% lower risk of late macular degeneration. Additionally, an association was observed between eating fish 2 times a week and having a reduced risk of early and late macular degeneration. The relationship between the density of the macular pigment and the onset of macular degeneration is well established. The macular pigment is composed principally of 3 carotenoids, lutein, zeaxanthin, and mesozeaxanthin, and these represent roughly 36, 18, and 18% respectively of the total carotenoid content in the retina. They're found within the macula and the surrounding tissues, including the blood vessels and capillaries which nourish the retina. Lutein, zeaxanthin, and mesozeaxanthin ensure the proper functioning of the macula by filtering out harmful ultraviolet light and acting as antioxidants. During the aging process, there's a decrease in the levels of lutein and zeaxanthin. Low levels of the macular pigments are linked to macular degeneration. An autopsy study on donated eyes found the levels of all 3 carotenoids were reduced in those with macular degeneration when compared to the control subjects. The most significant finding, however, was the sharp decrease in the mesozeaxanthin in the macula of macular degeneration subjects. The post-mortem study helped to confirm other studies, and it indicated the importance of all 3 carotenoids for maintaining the structural integrity of the macula. These carotenoids protect the macula and the photoreceptor cells beneath via their antioxidant properties and their light filtering capabilities. Intake of lutein and zeaxanthin are important preventative measures, but they may also reverse the degeneration process when it's ongoing. Because lutein and zeaxanthin have the tissue-specific characteristics of all carotenoids, their natural tendency is to concentrate in the macula and the retina. Consumption of food rich in these substances is especially important as they have a direct effect on the macular pigment density. The denser the pigment, the less likely a retinal tear or degeneration will occur. Fruits with a yellow or orange colour, like mangoes, kiwis, oranges, and vegetables of a dark green leafy colour, oranges and yellow varieties, are all sources of lutein and zeaxanthin. Unlike lutein and zeaxanthin, mesazeaxanthin is not found in the diet, but is needed to maintain youthful macular density. Patients with macular degeneration have been shown to have 30% less mesazeaxanthin in their macula compared to individuals with healthy eyes. When taken as a supplement, mesazeaxanthin is absorbed into the bloodstream and it effectively increases the macular pigment levels. Anthocyanins and cyanidin 3-glucoside, or C3G. They're critical components of bilberry, and they're powerful antioxidants. Positive results have been noted in many animal studies and some human studies using bilberry for macular degeneration, as well as for other eye disorders like diabetic retinopathy, retinitis pigmentosa, glaucoma, and cataracts. The C3G has been shown to improve night vision in humans by enabling the rods in the eyes responsible for night vision to resume functioning faster. In animal cells, C3G regenerated the rhodopsin, the retinal complex that absorbs light. The anthocyanins in bilberry decrease vascular permeability by interacting with blood vessel collagen so as to slow down the enzymatic attack on the blood vessel wall. This might prevent the leakage from the capillaries that's prevalent in neovascular macular degeneration. Studies also show that bilberry increases oxidative stress defense mechanisms in the eye, and there may be additional benefits by adding vitamin E. C3G, which is highly bioavailable, enhances other functions of the body. It's a potent antioxidant, and it protects tissues against DNA damage, which is often the first step in cancer formation and the aging of tissues. C3G protects endothelial cells against peroxynitrite-induced endothelial dysfunction and vascular failure. In addition, the C3G fights vascular inflammation by inhibiting inducible nitric oxide synthase. At the same time, it upregulates the activity of endothelial nitric oxide synthase, and this helps to maintain normal vascular function. These effects on blood vessels are especially important in the retina, where delicate nerve cells depend on the single ophthalmic artery for their sustenance. In animal models, the C3G prevents obesity and it ameliorates blood sugar elevations. One way it does this is by increasing gene expression of the beneficial fat-related cytokine adipocytin. Diabetics, of course, are predisposed to severe eye problems, including blindness from elevated blood sugar levels. It helps to induce apoptosis or programmed cell death in a number of human cancer cell lines, an important step in cancer prevention. In a similar fashion, but via a different mechanism, it stimulates rapidly proliferating human cancer cells to differentiate so they more closely resemble normal tissue. Finally, it was discovered that the C3G is neuroprotective in experimental cellular models of brain function, helping to prevent the negative effects of Alzheimer's-related protein amyloid beta on the brain cells. Grapeseed extract is a bioflavonoid. It's a potent antioxidant. Plant-derived bioflavonoids are readily assimilated in the body when consumed. Bioflavonoids appear to protect the retinal ganglion cells. Studies conducted in fruit flies have revealed the grapeseed extract attenuates the aggregation of the pathologic proteins, and this suggests a protective effect against macular degeneration and neurodegenerative disorders. Accordingly, fruit flies who were administered grapeseed extract exhibited improved eye health. Similar experiments in diabetic animals indicate grapeseed extract limits the ocular blood vessel damage seen in diabetic retinopathy, or the degradation of the retina, and this shares some pathological characteristics with macular degeneration. Compelling lab evidence demonstrates grapeseed extract can inhibit angiogenesis in human cells, and this suggests the grapeseed extract might suppress the apparent blood vessel growth observed in wet macular degeneration. Resveratrol is a potent polyphenic antioxidant, and it's produced by grapes and other plants for the protection against pathogens. In humans, it exerts a broad range of physiological effects when ingested orally. Several studies have demonstrated cardioprotective properties of resveratrol, including endothelial protection and the attenuation of oxidized LDL-induced vascular damage. In addition, emerging evidence indicates resveratrol might combat macular degeneration and promote eye health via several mechanisms. In an animal model, it was able to stave off diabetes-induced vascular lesions. Moreover, the same study showed resveratrol was able to dampen VEGF signaling in mouse retinas, a key pathologic feature of macular degeneration. Another study corroborated these results by showing resveratrol inhibited angiogenesis, and it suppressed retinal neovascularization in mice who were prone to develop macular degeneration due to a genetic mutation. Also, several lab experiments have suggested additional protective mechanisms of resveratrol in macular degeneration, including protecting retinal pigment epithelial cells from hydrogen peroxide-induced oxidative stress and light damage. Given these exciting initial findings regarding resveratrol and macular degeneration, along with its stellar track record in a variety of other conditions, it's believed individuals with macular degeneration, especially the wet variety, might benefit from supplementing with resveratrol. Saffron is commonly used as a culinary spice, particularly in regions of the Mediterranean and the Middle East. It's also used as a medicinal herb, and it contains several carotenoids, including crocin, quercetin, and saffronol. Preclinical research has found that saffron and its constituents promote healthy retinal blood flow and protect the retinal cells from damage due to light exposure and oxidative stress. Multiple clinical trials have shown that saffron might be a viable therapeutic agent in macular degeneration. In a randomized, controlled crossover trial, 25 subjects with early macular degeneration were given either 20 milligrams of saffron or placebo daily for 3 months, and then switched to the alternative intervention. Retinal flicker sensitivity, a marker of macular health, improved with saffron but not with the placebo. The researchers then evaluated the longer-term benefits when 29 subjects with early macular degeneration were given the same dose of saffron for an average of 14 months. Not only was the retinal sensitivity improved by 3 months, but visual acuity also improved, with the subjects being able to read an average of 2 lines more on a standard vision chart when compared to the baseline. Improvements were maintained throughout the follow-up period for up to 15 months. In another study of people with early macular degeneration, after taking 20 milligrams of saffron per day for an average of 11 months, retinal sensitivity improved, whether or not the participants had a genetic vulnerability to the condition. In another study, specifically considering dry macular degeneration, 50 milligrams of saffron per day for 3 months significantly improved visual acuity and contrast sensitivity versus no noted improvements in the control group. In a larger crossover study of 100 individuals with mild to moderate macular degeneration, 20 milligrams of saffron given daily for 3 months significantly improved the visual accuracy and a measure of retinal response compared to placebo. The saffron also was shown in clinical and preclinical research to help to prevent other common ocular conditions. Ginkgo biloba improves the microcapillary circulation in the eye, and it slows deterioration of the macula. By inhibiting the platelet aggregation and regulating the blood vessel elasticity, the ginkgo improves blood flow through the major blood vessels and capillaries. Ginkgo is also a powerful antioxidant. Glutathione and vitamin C are antioxidants and are found in high concentrations in healthy eyes and in diminished quantities in eyes with macular degeneration patients. Vitamin C aids glutathione synthesis in the eye. When combined with cysteine, an amino acid antioxidant, cysteine remains stable in aqueous solution and is a precursor to glutathione synthesis. Vitamin C is important because it absorbs ultraviolet radiation, and this contributes to cataracts. Topical vitamin C inhibited angiogenesis in an animal model of inflammatory neovascularization. L-carnosine is a naturally occurring antioxidant and anti-glycation agent. Studies have shown carnosine inhibits lipid peroxidation and free radical-induced cellular damage. Topically applied, N-acetyl-carnosine prevented light-induced DNA strand breaks and repaired damaged DNA strands, as well as improved visual acuity, glare and lens opacification in animals and humans with advanced cataracts. Selenium is an essential trace mineral and is a component of the antioxidant enzyme glutathione peroxidase. It's important for slowing the progression of macular degeneration and other eye disorders, including cataracts and glaucoma. In mice, increased expression of glutathione peroxidase protected against oxidative-induced retinal degradation. CoQ10 is an important antioxidant and it might protect against free radical damage within the eye. Mitochondrial DNA instability is an important factor in mitochondrial impairment, culminating in age-related changes and pathology. In all regions of the eye, the mitochondrial DNA damage is increased as a consequence of aging and age-related diseases. In one study, a combination of antioxidants, including CoQ10, acetyl L-carnitine, and omega-3 fatty acids, improved the function of mitochondria in the retinal epithelial pigment, and subsequently stabilized visual function in patients who were affected by early macular degeneration. Riboflavin, or vitamin B2, taurine, and R-lipoic acid are other antioxidants, and they're all utilized to prevent macular degeneration. Riboflavin is a B-complex vitamin, and it reduces oxidized glutathione, and it helps to prevent light sensitivity, loss of visual acuity, as well as burning and itching in the eyes. Taurine is an amino acid, and it's found in high concentrations in the retina. A taurine deficiency alters the structure and the function of the retina. R-lipoic acid is considered a universal antioxidant because it's fat and water-soluble. It also reduces choroidal neovascularization in mice. Recent advances surrounding the cause of macular degeneration have unearthed shared risk factors with cardiovascular disease, as well as similar underlying mechanisms, particularly elevated biomarkers of inflammation and cardiovascular disease, including C-reactive protein and homocysteine. Researchers have identified elevated levels of homocysteine and low levels of certain B vitamins critical to metabolism of homocysteine are associated with an increased risk of macular degeneration and vision loss in older adults. A study has found supplementing with folic acid, B6 and B12 can significantly reduce the risk of macular degeneration in adults with cardiovascular risk factors. The data, along with additional confirmatory studies, has convinced physicians to start recommending B supplements in patients with macular degeneration. A study in more than 5,000 women indicates that including folic acid at 2.5 milligrams per day, B6 at 50 milligrams per day, and B12 at 1 milligram per day in the diet may prevent and reduce the risk of of macular degeneration. The largest and most important study of nutritional supplements in macular degeneration is the age-related eye disease study. The AR-EDS study demonstrated a reduction in the risk of the progression to end-stage macular degeneration when vitamins and zinc supplementation were given to the patients with advanced forms of the disease. Thousands of patients were followed for over 6 years, and the AR-EDS study revealed significant improvements for the patients with macular degeneration, and it recommended antioxidants plus zinc for most patients with macular degeneration, except those with advanced cases in both eyes. The AR-EDS formula consists of the following, which is to be taken daily: vitamin A as beta-carotene, vitamin C, vitamin E, zinc and copper. An 8-year trial of 2,924 eligible AR-EDS macular degeneration participants found, independent of their supplementation, a higher intake of DHA and EPA was associated with a lower risk of progression to advanced macular degeneration. Following the revealing data that was found from the AR-EDS, additional research on zinc has shown significant activity in treating macular degeneration, specifically the dry form of the disease. In a clinical study, a zinc monocysteine supplement significantly improved visual acuity and contrast sensitivity when compared to a placebo. There has been limited success with conventional medical treatment protocols to restore lost eyesight from any form of macular degeneration. Leading researchers are documenting the benefits of more holistic approaches. Patients are encouraged to increase physical fitness, improve nutrition, including a reduction in saturated fats, abstain from smoking, and protect their eyes from excessive light. Dietary supplements with trace elements, carotenoids, antioxidants, and vitamins is recommended for improving the overall metabolic and vascular functioning. An early screening and patient education offers the most hope for reducing the debilitating effects of macular degeneration. For more on herbs, supplements, and natural treatment plans, check out my website.